When should you consult neurosurgery to consider tapping a VP shunt? Well, there's pretty much two main indications for tapping a VP shunt, and that would be concern for shunt infection versus concern for shunt malfunction. Now, when we're talking about concern for shunt infection, one of the common consults they get is patient just has a history of a VP shunt and they're coming in with a fever. So is this a situation that actually warrants tapping the VP shunt? And in most cases, the answer is actually going to be no. So let's just quickly review the anatomy of a VP shunt. And so we have this device that's going into the ventricle, and there's this little reservoir that can be accessed by neurosurgery. And then this drains all the CSF, usually down into the abdominal cavity or into the chest. And so when we ask them to tap it, what we're asking them to do is just take a little needle and poke the reservoir, which is right on the scalp. It's very easily accessible. And then they can test the CSF to see if there's any signs of meningitis or shunt infection or something like that.